Every time you write my place, I do wanna say it to you, my babe. I won't be too late.
Hi guys, Nurse D Shay here. If you're new to this channel, here we discuss all things nursing, health, and finances. Today I have a very special guest with me. I have Dr. Dolapo, and so we're just going to get into some questions. Dr. Dolapo is a holistic doctor, so we want to get into her journey and just some information about that. Okay, so Dr. Dolapo, would you mind just telling us something about yourself and where you're from?
Yes, thank you so much. I'm so pleased that you're here. It's such an honor for me. So I am Dolapo Babalola, as you mentioned. I am a family medicine doctor, and I'm also boarded in lifestyle and obesity medicine. I'm originally from Nigeria, but I've been in Atlanta for, oh my goodness, almost 22 years now.
Wow.
Yeah, so I started out in the traditional healthcare system, seeing patients at Grady, as well as being a faculty at Morehouse.
Wow.
And so I've always been a preventative focused. So a lot of times I saw my patients, we did group visits, but my mindset of really getting to the root cause of diseases instead of just masking with medication was what led me into open up my own practice about a year ago. It's actually 1 year. Last week was a year that I've been open.
Congratulations.
Yeah, thank you. It's just been so much joy for me not having to rush through seeing patients and spending the time that is well needed to get to the root cause. Figure out how can I provide the skills instead of the pills, and instead of just sick care, provide health care.
Yes.
So that's a little bit about me. I, other than just medicine that I practice, I'm married, I have 3 kids, we're adventure seekers, we're lovers of God, and, just all the things that just make life worth living. So I'm really, truly honored that you're taking the time to interview me. Thank you.
Thank you for allowing me to, because that's just so funny, because I was just telling my husband the other day, he got diagnosed with arthritis. And I said, they give you, the steroid and the pain medicine. And I said, that's just managing your symptoms.
Yeah.
But what you actually need to do is lose weight. We need to eat less salt. You know what I mean?
Yeah.
I was trying to tell him you have to treat the root cause.
Absolutely.
And I think that is something that is not practiced much in
the traditional healthcare. Because the time is not enough. It's not there. 15 minutes does not cut it.
Yeah.
I mean, you barely get in, and I had a patient say the other day that, oh my goodness, direct primary care is the way to go, because for years when she goes to the doctor, she has her list, and the doctor will tell her, I only have 12 minutes. Tell me one thing. How do you decide what is more important, right? So to your point, with arthritis, what is the root cause? What is the underlying factor? If you can't get to that, then you can't really treat it other than giving medications.
It's going to keep coming back.
Yeah, and then of course the side effects of the medication. So I'm just really pleased to have been able to open up my own practice. And even when I was in traditional healthcare system, I was that doctor that was always running behind, because I didn't want to rush patients. I really wanted to dive in a little bit more to what's going on with them. Yeah, so that's just what it is.
Well, thank you for that, because it's something that is needed in medicine, and thank you for that.
Yes.
Was that a hard transition for you?
Well, it took some time. I must be honest. It took some time to get to that point where I was like, oh my gosh, what do I do? Where do I go from here? Again, when I was in academia, I loved it. I loved teaching. I loved seeing my patients. So it was fun. It was never a dull moment seeing the patients, but I always felt burnt out by the time I was spending that extra 10 minutes, 20 minutes. I wasn't writing notes. I wasn't looking at the computer. So at the end of the day, I had 26 charts to close, and it would run over. So, I knew things had to change, but I wasn't sure where and how, especially because I never intended to open up my own practice. That was never in my design. I really just wanted to be employed, do the best I could to care for my patients, and go home.
Wow.
And so when the last 5 years of being in academia, which I was for 16 years, I was just praying, and I was just trusting God, what next? And I really looked for places that aligned with the way I practiced, that they would hire me, but they were all out of state. And my family said, sorry, we're not going with you.
Yeah, that's a hard move.
Yeah, that was a hard move. And then I learned about direct primary care. And the moment I heard about it and prayed about it, I realized that if I don't have to deal with the insurance company, which is the middleman that dictates quantity.
And I'm on that side.
Yeah, that dictates the quantity of patients over the quality, then I'm like, okay, this is possible. So that's when I started opening my mind and being flexible about seeing patients under the direct primary care model.
I absolutely love it. I love it. When I heard that, I was just like, oh my God, I would love to just talk with her about that and get more information to the community that this is something that you're offering, because a lot of times that's what's asked for. And so I think that it's just a matter of getting the information out and letting people know that you're here, because that's a great thing that you're trying to do. And I love that you said that you didn't know that it was available. Do you feel like God kind of opened that door for you?
Absolutely. I mean, I was seeking and I was looking 5 years, I said, and I needed to be comfortable. You know how they say that the grass on the other side is not as green? So I was like, oh, okay, this one, the evil you know is better than the evil you don't know. So that's why I stayed with it for 5 years. I mean, I continued to embrace, I really enjoyed seeing my patients. So my patients were fine. It was just the burnout that I couldn't take, and the fact that I didn't have the time and the energy day in, day out to care for my patients the way they deserve. So in terms of praying, the day I decided was when a patient on a Wednesday morning asked me, the first patient I saw on that Wednesday, I still remember the day like it was yesterday. She said, I've been seeing you for 7 years now, and I want to keep seeing you, but I have to move to the other part of town. Do you have your own practice? And I was praying coming to work, because I used to drive 45 minutes to work, 60 if there was traffic. And I was like, okay, God,
I did not want to leave you.
Hey, listen, there's no other way. I'm like, this is confirmation. This is what you're doing, DPC. So yes, it was prayer. It took time. But once I decided, there was peace that transcends all understanding, and I was just ready, and I haven't looked back. And since I've opened my practice, it has been work, yes, marketing, and it's my own now. I have to go out there and promote, which I'm not I'm not the best at it, but I love that I can take my time, and my patients say thank you. They're like, thank you for discussing this with me. Thank you for spending time with me. I mean, that makes me feel like I'm doing what I was born to do, because in the other system, I was just always drained and
you don't
tired.
Feel like you're giving everything that you're supposed to give.
Yes, exactly.
Because I felt like that too. Even in nursing, I'm just like, I can't rush like this. I have to be able to take time and educate, because it makes a difference.
It does.
They really don't know. They need you to teach and to take that time. So thank you for that. I want to go back to your educational journey, right? Because I talk about education a lot on this channel. I talk about finances and all the things. But I think you said Morehouse Medicine? Is that where you went to?
So I did my residency at Morehouse School of Medicine, Department of Family Medicine. So, but I went to medical school in Guyana. I actually started out I'm from Nigeria originally. So I started out in Nigeria. And so I did my prelim. I did my first pre-clinical in Nigeria, but when there were so many strikes occurring, my aunt, who is my mom's oldest sister, is a professor at University of Guyana, and was visiting Nigeria. One of the times when we were at home for the strike that was going on for three months, she was like, you know what, just come with me, come to the medical school in Guyana. And I did, and I completed the clinical aspect. That was interesting. Oh gosh, it really was. But I was grateful for the time, because oh my God, I have friends from Guyana, I have friends from, it's just amazing the breadth of friendship that I've developed. And because I was a foreigner, they treated me like gold. I felt like I went to places that some of them never have been to, and they were born and raised in Guyana. And the food, don't let us get started with the food, because it was amazing. The oxtail, the curry, all the roti,
fresh, right?
Yes, fresh.
Organic,
it was
everything.
Yes, it was great. I enjoyed it. I had and I still in touch with my friends. Yeah,
that sounds amazing. So, in terms of finances, was it something affordable?
Yeah.
Or would you, in comparison to U.S., because we know that is like so expensive.
Great question. Yeah. Well, I was on a scholarship because my aunt was a professor in university, her husband also. So I didn't have to pay out of pocket. So so that was another blessing. So that was a blessing. But in terms, to answer your question though, yes, it's still higher in cost compared to American medical schools.
Oh, really? It's higher?
Yes, it is high. I mean, sorry, American is higher, not Guyana. Okay. So excuse me there. So, but in offshore, you have a lot about offshore universities like Ross, University of Guyana, and all those schools. They are slightly lower, but it can be very competitive because a lot of people tend to want to go there to save costs. Maybe they're not able to get into the U.S. Just there's so many reasons. But yeah, it is becoming more. When I graduated in 2000, there weren't that many foreigners or just going to out offshore to do medical school, but now it's a common thing.
What kept you going through that journey in school? I know that sometimes it gets very difficult. I know that you went in even another country difficult. I know my husband talks a lot about sometimes the power would go out and different things like that. So what was your driving factor to become a physician?
Yes. So I chuckle because of the power would go out. Yes, but that was in Nigeria. I didn't go out in Guyana.
Oh, did
yeah.
it? Okay. that struggle.
That is in Nigeria. Yeah. Yeah, but you see, I had a desire to become a medical doctor right from when I was 5. I know people can't believe it, but yes, as young as 5, I'm the oldest of 4 kids. And my father was a professor of neurophysiology. He actually started out wanting to become a doctor. So he was in the University of Ibadan studying medicine, but he lost his mom at a very young age. And he was like, why am I studying medicine? The reason why I wanted to be a doctor is to take care of my mom. So he changed his major and went into neurophysiology. So I saw him in the medical light, always teaching, and I just admired that. And I think it was inborn for me. And being the oldest of 4, I will just, out of curiosity, take my dollies, do something to them and fix them back. I was just very interesting human being. So I always wanted to be a doctor. So in terms of, yes, it was challenging, I won't lie. Get into medical school, I had to take an exam again to do it and make sure, because I got in for microbiology, but I wanted to study medicine.
Okay.
So I was one of the 4 people that it took out of 250 to change. That was the determination. So to answer that question, it was both my passion, my faith, and community. That was what got me going all through medical school, because I really I couldn't see myself doing anything else. So I just kept pushing, praying.
Chills.
I know. Every time I say it, I get chills too, because I remember the first year I didn't get in, and when I got into micro, everyone was like, just do it, you're fine. Why do you want to do medicine? Why stress yourself? But I was like, no, this is what I want to do.
Like everybody has that fight to get there, right? Like that, okay, this is where God wants me to be.
Yeah.
But just that fight to get there, everybody has really just trusted God with their journey that I've been talking to lately. And it's just been so motivational because I really feel like God puts that passion in you. And you can't get rid of it.
You can't. You're like, no, it's this or nothing. And God truly came true. Oh my gosh. Yeah, 4 out of 250. And I'm just so grateful. And that journey has continued. I've always wanted, and the biggest challenge after getting into medical school is now trying to decide, what kind of doctor do I want to be? Because I loved everything. Do I want a pediatrician? I loved pediatrics. Do I want to deliver babies, which I did. So family was the perfect match.
Okay, so
yeah, delivered. Yes, the first few years out of residency, when I was working at Morehouse, I delivered babies, but I did that very briefly for about 4 or 5 years. But family medicine gave me that opportunity, because we say family medicine is from cradle to cane. So I got the training for that, and so I love family medicine because even here in this practice is full spectrum family medicine that I practice. So
that's awesome.
Pediatrics, mental health, women's health. I'm a one-stop shop. I could do your pap smear, because I get my pap smear from my own family physician. I don't have the time to be going to an OB appointment and all
this and that.
Now, my delivery, of course, my children are delivered by an OBGY, but again, full spectrum family medicine is what I practice.
Awesome. So you've kind of worked. So you worked in L&D. Where did you spend the majority of your career before transitioning to holistic?
Yes, so it was more ambulatory. So I did ambulatory. So that was clinic. So a lot of clinic. It was combined with some hospital.
Okay.
So the way it's designed at Morehouse, you're a faculty, but you see patients in the clinic, and then you get some time off in the hospital. Then when you're done with 2 weeks in the hospital, then you go back.
Well balanced.
Yeah. So, and I loved it because
good.
it was good. There was never a dull moment for me. So, but the most time I spent was in the clinic.
Okay. So then, during COVID season, were you in the hospital setting then? Did you see all the craziness going on then?
That was when it stopped. So 2019 was when hospital stopped for me.
Okay.
Yes, I was in the clinic. And yes, it was just wearing our masks and swapping people, doing examination. That was what it was. Yeah.
Because I think a lot of physicians left not only physicians,
Yeah.
every line, really.
During the
Every
pandemic.
single area of healthcare. I feel like a lot of people left during that season because it really was just a lot going on. I remember being in the hospital and a physician just getting so overwhelmed because I think sometimes people forget that physicians are
human beings.
They
Yeah.
are human.
Yeah.
Need everything just like you and I need. And so she was really overwhelmed and she just said, I can't do this anymore.
Yes.
You know, and I just, you know, I pulled her to the side. We talked, we prayed and all the things, but I get it. You know what I mean? She's been doing it for a long time. And I think that sometimes that COVID season, I think was just a breaking point.
That was the that was a period when, you know, I said I thought about this for 5 years. When we hit 2020, I went downhill. I just lost my dad in January. We buried him March 17. I got back into the country and everyone shut down. So it was depression for me, gained a lot of weight. That was when I got boarded in lifestyle medicine because I really needed to heal. And that restored me and restored, because I wanted to quit medicine. I really wanted to quit that year, 2020, you know, but then I found lifestyle medicine. I did additional training. I realized that our bodies are placed in the right environment, it can heal. So mentally I was able to heal.
So you found that place.
I found the place, and I started a podcast that year. So there was a lot that I did because we were all home stuck, right?
What's the name of your podcast? You guys go and follow this podcast.
It's called Living at Your Finest.
Living at Your Finest.
So that was when Living at Your Finest was birthed out of my healing. I just had to heal. It took a few months, 3 months. I was able to heal, and then Living at Your Finest was birthed. It was an outlet for me, and that my practice is called Living at Your Finest Wellness. So in 2023, when I finally decided, I just added the wellness and made it a brand. So that's,
everything kind of
it all just fell in place. Yes.
So God's hand was on you.
Oh yes, yes, and I'm so grateful. I'm so thankful to God. It truly was. Yes, and that's an encouragement for people that when hope is lost, just know that there is just joy. Just hold on tight, even if you can't
whatever
see it.
your journey
He's
is,
there, and he's
there. And just like Dr. Dolapo has her story, so many of us out there, God has really been our peace, our push, our motivation, our everything, you guys. So if you find that you are in a state of depression, anxiety, it's so many things going on around the world, it's easy to slip into that.
Yes.
Find your peace in God and also therapy.
Yes.
And seeking beautiful doctors like this who truly care about your holistic well-being. So thank you for that. Thanks for sharing that. And so you have a journey that you experienced as well. I know you said you gained a lot of weight during that time and other things going on. Was there a health journey that you went through? I think you shared something.
Yes. So I had 2 major health journeys that I experienced. The first one was the birth. It was 16 years ago during the birth of my second child. So I was so overwhelmed. I didn't even know I was stressed. You know, you can be so stressed. You're so tired and wired that you just, it takes God to just like slow down.
Okay.
You don't slow down.
You have to shake
But I was overly stressed. I had just finished residency, and I was grateful to have the opportunity to work at Morehouse as a faculty member. But I just I had my second child. I had a 3-year-old and a newborn, and I was having the worst headache ever. And it took 4 days for me to be like, okay, let me go check my blood pressure. I didn't even think it was blood pressure issues. I thought I was just sleep deprived because I just had my second child. But I was overwhelmed. I wanted everything to be perfect. I wanted, picture perfect. You know how we can get professional women. We want everything to look all the same, regardless of the fact of changes of season. I wasn't listening. So I had the worst headache ever, and 4 days was getting worse. And I'm so grateful to God that I actually thought about blood pressure, and I checked. It was 220/120. So
that's very high.
That was very high. My headaches were like something was hitting me constantly on my head, and I never had headaches like that. So I went to the emergency room. They did all the tests. They were still looking for eclampsia, because you can still have eclampsia, like pre-eclampsia and all of that after delivery. Everything was negative. My head CT was negative, but the doctor said if I had only just delayed, because they had to start the drip right away to get my blood pressure down. And he said if I had only delayed, that I would have had a stroke or I would have bled out. So that was the first health scare. And 3 blood pressure medicines couldn't even get my blood pressure down. I was gradually, they kept adding, because again, I was now adding more stress because I want this blood pressure to go down. I was taking it every minute. But and unfortunately, my doctors didn't really have the time. Just medicine, bye, go, we'll check you back in 2 weeks. So, but I got to the root cause. I was just praying, God, listen, I'm so young. I think I was like 20 something at the time. I was very young, and I was like, even though I had family history of blood pressure issues, I just said, God, I just need healing. And that was when I realized it was stress and the food. I was emotionally eating. I've always been a sweet tooth, and I would eat to bury my fears and troubles and concerns. So I just really started walking. So I figured out who would take care of my child.
Okay.
And then I started walking, and I started back journaling.
Like walking around the neighborhood?
Just walking, exercising, mental health, fresh air. The things that we say we can't do because we're so busy.
Right.
I started doing those. I found a way to do it, and I just did it little by little. And I was able to get off the blood pressure medicine because my blood pressure was controlled.
Controlled?
Yeah, it was controlled within that 3 months. Yes, I also lost weight with the.
Okay.
I mean, that was
Just
not the
walking.
intention. I just needed mental, clarity, and then just walking. And then when I walked, it was like a ripple effect. I was better, mind and sound. That I didn't feel like I need to emotionally eat and eat the big cake that I used to
so
eat.
it basically broke the cycle.
It broke the cycle because I had an outlet, which was movement and journaling. Because that was when I wrote my book, actually. Yeah, that was when I wrote my book, because it was a mental dump and release that it was giving me so much comfort.
I needed that. Because I'm in the cycle currently.
Oh, yeah.
Some of you may be in the cycle.
I mean, I never set out to write a book. I never planned to write a book, but I was journaling every day what was going on with me, how I was feeling, and I thought, wow, okay, this is helping me. This might well be a book, a self-published book, and it became a book, and it was titled My God, Even in the Last Minute.
Wait, say the title of the book again.
My God, even in the last minute. In the last minute. So he always shows up, even if it's the last minute. He will show up.
Yes.
When you feel like it's all done and nothing can help you out of your rut. Yeah. So that was the title of the book, and I was just so pleased. And it's been 16 years now, so I've been off blood pressure medicine, haven't been back.
16 years. Do you still walk?
Yeah, I still walk. I love walking.
Okay.
We have a community walk that we do every
really?
the second Saturday of every month. So yeah,
nice.
if anyone is in the Atlanta area, East Cobb,
I'm
Marietta,
about to join you guys.
yeah, please come. It's just an hour. We talk about health related topics, and then we walk 30 minutes. It's really good. Yeah, it's called
just a 30-minute walk.
Yeah, 30 minutes walk. The first 30 minutes is we communicate, we talk, meet new people, and then we talk about a health related topic, and then we go walk for 30 minutes.
Oh, I'm gonna have to start walking again.
Yes.
I used to climb up Stone Mountain, and that was a very good release for me, because it was like getting to the top. Are you gonna make it? Are you gonna have, and then I make it, and then it's like,
yeah, and that was where I met you, and I was so honored to meet you. It was great.
no, not Kennesaw Mountain.
Oh, Stone Mountain. Oh, okay.
Yes.
Yeah, I climbed that one before, but because of the distance for me, where I come from. But but that's good that you do that. Any form of walking in nature is, it's therapeutic. It really is.
And walking is free, you guys. So if you're wanting to start a health journey, a lot of people say walking is the best way.
And because walking, you're using all sides of your brain, the right and the left, and it's cross movement, right? So it really is very effective. If that's, even if it's just
mental
5 minutes
and everything. Wow.
So that was the first one, and then the second one was the one I alluded to in 2020 with the loss of my dad, and then I gained weight again, and it was just a lot of things going on. I had chronic fatigue. I couldn't sleep. I had arthritis, joint issues, because I was eating a lot of sugar. Of course, at this time, I'm already older, right? So the things that I could get away with when I was younger, I wasn't getting away. I wasn't getting away with it anymore. So, oh my gosh, trying to get up, my kids would be like, what kind of old woman are you? With me. But when I found lifestyle medicine and the power of life habits and behaviors, getting, just tailoring our life.
Consistency.
Yeah, consistency. And so I went to get additional training on sleep, how to maximize my sleep. And then,
do you offer any trainings?
Yes, I do have courses. Yes, I have courses online because again, I healed from my own training about sleep. So I have courses on sleep. I also have on stress management because those were the things I battled with, right? And so I have that, and then weight, because I learned the healthy way to lose weight, because I was notorious for being a diet.
So what is the healthy way?
Yeah, you gotta learn how to eat, the foods to eat, when to eat it, and how to eat it. That matters. But then I would just calorie restrict. I was on any diet. Just name one diet. I've been on it. I would lose weight, but then I'll gain it back plus more, and then I'll lose muscle. And when you lose muscle, we're already losing muscle as we age, and then if you lose more muscle, then you're increasing your fat. So those were the two health scares that I had. But I'm grateful to God that I learned, you know, just through additional training, how to properly, sustainably, and transformatively, you know, keep the weight off.
Because you're not just talking the talk.
Yeah,
you're actually walking the walk.
Walked it, yes.
And you've been through it. So someone who may be taking a bunch of medications and they're like, I want to start this journey and eliminate my medications and all the things. What would be your advice to that person getting started?
Yeah. So the advice is, secondly, the one thing you need to know is not to be overwhelmed, because sometimes we get overwhelmed. We want to do everything. We want to change everything. We cannot do that. Our bodies are not set up to live in overwhelm. So the first thing is know your why. Why are you trying to do this? Why do you want to do it? Is it because you want to have more energy? You want to spend more time with your kids? You know, you want to get off meds, like you alluded to. So once you know your why, then you need to find that support system, because we can't do it on our own. I couldn't do it on my own. I needed help. So find that support system that will help you figure out what things do you need to work on, and one by one work on them. For me, it was stress, and the stress led to me overeating. So if it's just one thing you pick, start there. And that mentality of all or nothing, just cross that out and give yourself grace. Grace. You know, it wasn't built in how they say the mountain wasn't built.
Rome wasn't built in a day.
So give yourself grace, be patient with yourself, and then know that it's progress, not perfection. So that's where I would say you will start, but it's doable. It is possible. I've done it. I've had lots of patients that we've been able to get off meds. Even my husband, I don't know if I mentioned to you, diabetes, A1C of 12, was able to get it reversed.
Well,
to
I'm going to put the normal range of A1C and blood
pressure. Anybody greater than 7 is
over.
Diabetes. He had 12, and he was able to reverse it. He had all the complications.
Was he on
of
medication?
Diabetes. Yeah, he was on he had to be on insulin, all of that at 12. Because not only did he have a 12 A1C, he had all the side effects, all the symptoms of having that high. He was running. He couldn't get to the bathroom quick enough.
Oh,
yes, it was bad. Blurred vision, all of that. So gradually, and you have to be very strategic about it. What things do you need to address? What you need to work on? Be on the medicine, yes, because you don't want any further complications. But then you
don't stop your medicine.
Don't stop your meds.
Not right away.
Yes, and then we de-prescribe, and that's what we did for him. So he was on insulin, just name it, metformin.
He weaned off of
and then gradually weaned off when his numbers were monitored and he had improved. So even me, I still check my blood pressure. I'm glad my blood pressure is within normal range, but I'm very mindful of it. You know, if I eat things that are not good, I can feel it in my fingers swelling and all of that. So so that's how you do it, one day at a time, and you just continue to just follow your numbers and follow the way you feel, and it is possible.
Your body will speak to you.
Yeah.
And you guys, Dr. Dolapo's practice is here in Marietta. Check her out, you guys. She takes insurance?
Yeah, so the only insurance I take at the moment is Medicare, but otherwise it's a direct primary care membership-based practice. And so what that means is I get the opportunity to provide patient-centered care for you that is personalized without the interference of insurance, because insurance company unfortunately want to predict the quantity over the quality of care. So no insurance. I do see patients that have insurance, but I just don't bill them for my service. So my service is a one flat fees once a month, no co-pays. So it's like the Netflix of medicine. But again, with your insurance, we can bill for your labs or imaging or medications or whatever. But for my own services, which I provide, which is personalized care, individualized, it's just a flat membership fee.
Which is awesome, because you pay one fee and you can see her as many times as you need to. Via Zoom or via in person. So that is amazing. I'm like wanting to sign up today. You guys, I'm gonna put the address of the practice in my description. Check it out and visit Dr. Dolapo. She has an amazing book Say the name of your book again.
My God, even in the last minute.
My God, even in the last minutes. I'm gonna find it and I'm gonna put a picture here in this video, and I'll also put a link to the description in the description box. You can follow Dolapo on
So on Facebook and Instagram and LinkedIn, all the names are the same except LinkedIn, which is just my name, Dolapo Babalola. But on Instagram and Facebook, it's Living at Your Finest Wellness.
Okay, thank you. So thanks for tuning in, guys. Don't forget to like this video, comment down below if you enjoy what you've seen, and subscribe to this channel. And as always, I will keep them coming. Bye, guys.
Bye. Thank you.